and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
This is Bonaparte. Napoleon Bonaparte.
Get it?
Yeah.
Anyways.
All right, today, Brad, we're going to talk about cubital tunnel syndrome. It could also be cell phone elbow, I think it's been referred to.
Right.
Or it could be a disc problem.
Right. So we've had a number of people, at least two people, request this. So it took me a little while to get at it, but here we got it.
We are responsive to you.
You better believe it. So
speaking of which, Brad, by the way, if you are new to our channel, which a lot of you are, please take a second to subscribe. Our subscribe button's right over here.
Usually down there.
We will respond to your requests if you have an idea for a video, and we also upload a video every day on how to stay healthy, fit, or pain-free.
Right. As far as the response, it may take a little while sometimes.
Yeah, that's right.
We get booked up. But
yeah,
anyways,
we get a lot of comments.
On cubital tunnel syndrome, okay? Cubital tunnel syndrome in the big picture is pain, numbness, tingling, nerve symptoms from here all the way up, and it goes to the pinky and half of the ring finger.
Okay.
They call that a dermatome, and that's where you typically feel the symptoms. Okay.
It's kind of like when you hit your crazy bone.
Yep.
That's
Yep.
that same symptom you're going to get because it's the same nerve.
Exactly,
Yeah.
in the same location. Actually,
Right.
the cubital tunnel is right there when you hit that, and you get that little shock going up,
Yeah.
and it hurts, and it makes you go like this. And once I said a bad word when that happened.
I bet you did.
Yeah. Anyways,
All right.
so when you get those symptoms, the big thing as a therapist, the first thing I think about is where is it coming from? Is it here? Or is it up here? Or it could be the first rib.
Sure.
You know, so we need to clear that out. I'm going to show you a really simple test. This isn't conclusive, but if you can sit there and you have the symptoms and you think maybe you have this diagnosis, first let's look at the neck. Sit up with good posture. You're going to look down, look up, rotate to the right as far as you can, rotate to the left as far as you can, do a chin tuck, and then do a chin tuck and look way back as far as you can. If you can do all that and it does not change anything in your arm or those symptoms, that's indicating it's probably not in your neck.
Especially also, I tend to see it connected, Brad. I mean, you'll get pain up here also in
Right,
the neck.
right.
Or the other test, I mentioned the other test that you could do real quick, where you just turn and go back.
Sure.
And then push down.
Right.
So you turn your head, go back a little bit, and then push a little pressure
Push
down.
it straight down.
That's squeezing the nerves a little bit, and so if that sends pain down the arm or increases it, that could be a possibility.
Right. Yeah, so if you do that and it makes it worse, there's a good chance it's not from this,
Right.
it's from up in your neck. I do have 3 tests we're going to go through to help confirm it is from here as well.
Okay.
But first of all, let's look at the anatomy of this a little bit more. So we're looking at the ulnar nerve, and unlike carpal tunnel, that's the median nerve, that's a whole nother story,
Right.
but they actually travel with each other. Ulnar nerve is at C8, so at the low neck. This red tubing represents, grossly where it goes. It comes through here.
There's
It
no
goes
C8, Brad, so T8, I mean...
C.
C7.
I looked it up yesterday. In my book, it said C8.
No kidding.
It did.
It's T1 then.
Yeah, well, the nerve is C8.
The nerve C8.
Right.
Yeah, okay.
There
I
we
thought you were
go.
talking about the vertebrae.
Right, exactly.
So, gotcha.
Yeah, we're talking about the nerve.
Okay.
Little technicality. Let's go on. So here's the nerve, and you can see it travels literally right through here, underneath here, and up underneath the first rib, and that's where it can also get trapped. Usually not so often, though. We're going to assume it's not because we're going to do the test down here later to help confirm this. It goes under the arm. Now look at this. This is important, I think. The mechanics of this. Can you see where the nerve is going? And here's that gap you can feel right in here, that tunnel, the cubital tunnel. Now watch when you flex your wrist. Watch how that nerve can stretch. And if that nerve actually pops over like that, that's a problem. That may not be able to get corrected without surgery. If you're feeling that pop over and you're having some real
You're
symptoms.
going to need to see a physician about that
Yeah,
one.
then you got to get in and see a physician. But oftentimes, if you just go like this and you're holding your cell phone up like this and you're feeling that, it may be just pulling it. We need to break some tissues loose, some scar tissue possibly. And it's going through the flexor muscles, which is this meaty muscle right here in your forearm. We're going to show you a treatment, what you can do with that to help reduce symptoms as well. And then the nerve goes right up to that pinky finger and part of the ring finger as well. So now you understand the anatomy of it.
Yeah, good demonstration, Brad.
Yeah, okay then.
So what are the tests?
Okay, the test. First one is the tap test. These are very similar to carpal tunnel tests, actually.
Sure.
The tunnel.
Yep, exactly.
Okay. So here's that tunnel. You can feel your medial epicondyle, your acromion, and it's right in between there. Okay, you can flex your elbow slightly, and you just start tapping on there. You'll tap for 30 to 60 seconds, and when you're doing that, if it's flared up, it more than likely is going to irritate
start
the
getting
symptoms.
symptoms,
Yep, and
the
it's going to go
tingling,
right up
right.
that same area where the nerve goes. Okay. The next one is you can put your finger in that groove. This one's a little more aggressive, and you roll back and forth across there. And this one, like I said, is more aggressive. I don't have any symptoms, no problems. I can roll in there pretty aggressively and have no problems. It's when you hit it hard, when you bump into a corner.
Right.
But no problems there. But if you got it, that should set it off as well. And then the next one is you go like this and put your hand back like this. You can do this with both hands, and that will stretch that nerve like we talked about here, and that may set it off as well.
Yep.
So those are three
All
tests.
makes sense.
If all three of them are positive, you probably for sure have got cubital tunnel syndrome. So one of the nicest things to treat this is not what to do to it, but what not to do to it.
Exactly.
So you don't continue to irritating the problem. So the first one is just like in the car, you put your elbow right on that armrest or on a chair. Especially,
well, I see it a lot. Brad and I work with a lot of patients in wheelchairs, and some of those armrests on the wheelchairs are really hard.
Right.
And people have come up to me and I'm getting this tingling in my pinky, and it's just from them leaning on that chair.
Right here, just getting that. This is a steel armrest here. That's going to be terrible on if I had a flare up of this.
So if you're at the office and you have armrests on your chair and you're leaning on them all day, or you just get in this habit, that alone can be causing your symptoms going down.
Exactly. So get rid of the armrest, put some cushions on there. Sometimes you can just take a towel and put a towel on there to cushion it so the force goes up in the meat of the arm instead of at the elbow. It can be enough.
Right, exactly. Good.
End range flexion. So you're going to not use a cell phone. You're going to avoid doing things where you're putting that elbow all the way to the end range. Yep.
Maybe also, get a headset or something.
Sure. Yep. If you're at the phone or exactly.
On the phone a lot.
Right.
If you're, right.
Right. Absolutely.
Oh.
Next thing, full extension of the elbow all the way out. Sometimes that will flare it up too. It'll irritate or pinch that nerve.
You're kind of trying to stay in this mid-range here, aren't you, Brad?
It's listen to your body. If something irritates it, don't do it.
You're trying to get the nerve to calm down.
Exactly.
Right? So, and while you're trying to do that, that's when you want to avoid these things.
And there's a stretch. If you're going to try and stretch it out, you're stretching these muscles. One of the stretches can be like this or like this. And you do want to stretch the muscles, and you can stretch that nerve a little bit, but if you overstretch and you pull that nerve too hard, it's going to irritate it, and that can be no fun for about 1 or 2 days.
Right.
Once you get a nerve irritated from overstretching it, it flares it up, and it needs time to settle down, and you won't be happy with yourself if you do that.
Stretching is not necessarily bad, but you're going to want to do it very gently and very controlled, and not increasing pain while you do it.
Right.
So.
And then the next one is, and this is an important one. This one's a little bit harder to control, but when you sleep at night, you may end up rolling or putting pressure on that spot and finding yourself waking up with a real sore or bad flare-up of the symptoms.
You got some pillows, Brad, here?
Yep. So at night when you're laying down, if you can adjust it so the pressure is going through your tricep in here, and this is one where you got to get some pillows out. Still, you need a pillow for your head, but here there's no pressure on that elbow or on that sore spot, and you're going to lay like this, and you're going to say, well, yeah, but when I sleep, I'm going to roll, these pillows are going to fall on the floor, and that is true to a degree, but if you tell yourself before you sleep, this is how I need to sleep, because it's going to, you can train yourself.
Yeah, and you can start, and maybe you have to readjust in the middle of the night, but if you're on your side, you can put 2 pillows like this and like this.
Yeah.
And, I'm on my side. Again, no pressure on the elbow. There's a lot of things you can do using pillows to try to get to the right
If you just
position.
ignore it and you sleep on it, you're still addressing the symptoms to help it out. Okay.
So what are some of the other treatments, Brad?
Some of the you can use a splint. if you just need, if it's so flared up and this is irritated at full extension, you can, go to the pharmacy, look it up online. You can get an elbow splint where it's going to hold it in one spot. A lot of times a splint just reminds you not to use it.
Sure.
It doesn't always lock it in one place, but once it's on there, and when you're thinking about something else, just touching that elbow, same with knee splints, is that you won't use it, and your mind subconsciously knows.
Right. It gives you some help that way.
Exactly.
So
the next one is these muscles, the flexor muscles right here. Remember that nerve goes through here and through the flexor muscles. You want to get in there, and you're going to work those muscles.
you're not going over the nerve.
Yeah.
You're working into the muscles themselves instead.
This is one of those things that if you're doing it and it makes the symptoms worse, you're going to need to back off. You're going too hard or in the wrong spot. So you want to work it so that it feels good. It's allowing the symptoms to relax and release. Then you know you're doing right. Sometimes people go with their forearm because your fingers will get tired after a minute
with their
or
palm.
two. Yep.
Yeah.
The palm. What did I say? Forearm.
Forearm. Yeah.
The
On the forearm.
Yeah, on the forearm with the palm, the heel of the palm, and get in there and work it like that.
It's not a bad one for a lot of people, especially who do a lot of typing or a lot of overuse type
Right.
injuries.
Yep.
So.
People that do a lot of hand work.
So last one, Brad.
Last one is a stretch I alluded to before. Is bend the elbow like this, hand up so the fingers go right towards your jaw. Take this hand and continue to flex the elbow.
Now again, this is one you can do very gently.
Right.
This one, because you're going to start, you want to get further and further. Well, we show people, it's called nerve flossing actually, and you
Right.
can just gently, but eventually you can get up to like this, that we could say if you can make the eyes on
Right.
both sides. Can you do it on both sides, Brad?
I can hardly, my arms aren't that flexible. But
Like that.
in school, there was a name for that, but
So I have a lot of times people just start like this.
Yeah.
And then eventually they get up into here where they got the glasses or whatever they call them.
and there's some people that just like me, when I'm 80 years old, I won't even have the flexibility to get to here. So you may have to go to here.
Again, very, very gentle. You do not want to fire that nerve up. So you're just kind of pushing into a little bit. Each day, try to work it a little bit further.
5 to 10 repetitions, and then forget about it
Yeah,
for a few
exactly.
hours.
That's right. Don't be overdoing this one.
Exactly.
So.
All right, so that's cubital tunnel syndrome in a nutshell. Good luck with it, and I'm sure with these techniques you're going to have some success. And Bob, what do you got to say?
I have nothing else to say, Brad. Thanks for watching.